So we're going to see what a consultation looks like in our clinic, right? We have a patient called Chukudubem who came in to fix her acne and some of the complications she has. Hello everyone, I'm Dr. Linda. Welcome to Skin 111's YouTube channel. So today we'll be talking about acne, its causes, its complications, and how we treat it in our clinic. Acne vulgaris is a skin condition where the hair follicles get blocked by oil or sebum, dead skin cells, and then causes an inflammation most times. Usually, persons with acne will present with comedones, either blackheads or whiteheads. They could also present with other features like your pustules, where you have a slight inflammation with a little bit of pus in it. You could also have papules, nodules, where you have a slight swelling beneath the skin. Acne also has its complications, and one of the very common complications of acne is post-inflammatory hyperpigmentation. Yes, it sounds like a long name, so we'll call it PIH for short, or simply put, your dark spots that you have after acne. Another complication, very common complication of acne, is atrophic acne scarring. Sometimes you could see some people that have acne and they have this tiny ice pick-like scars on their face, mostly on the sides of the face or forehead. That's what we refer to as atrophic acne scarring. Another common complication of acne is more like mental symptoms. Some people have anxiety problems, depression. I've met patients that have also said they've had suicidal thoughts, all because of how severe their acne is. So yes, acne is actually a very serious skin condition that should be treated as soon as possible. So we're going to see what a consultation looks like in our clinic, right? We have a patient called Chukudubem who came in to fix her acne and some of the complications she has. During the consultation, we asked her a couple of questions to be able to determine what kind of acne she has. We also asked her about her current routine. When we talked about her routine, we discovered that her routine wasn't adequate enough to address acne. It was a pretty basic routine she had. So we had to now restructure her routine, tailored for her own kind of acne. Also, she has complications of acne, like what we talked about earlier. That's a post-inflammatory hyperpigmentation. However, we noticed that she wasn't ready to have a chemical peel done, because when she came in at first, she wanted to have a chemical peel done. So what we did was to tailor her routine properly to address the acne itself and to also prepare her skin for the chemical peel. A chemical peel is an aesthetic procedure where a special type of liquid solution, usually an acid, is applied on the skin with the aim of causing controlled injury or trauma to the skin, such that the skin is now tricked into repairing itself and resulting in rejuvenation of the skin. Usually we would use chemical peels to address certain aesthetic concerns like acne, to treat scarring, pigmentary disorders like your post-inflammatory hyperpigmentation, like in the case of Dubem, melasma, to also address fine lines and wrinkles. So the thing about chemical peels is that for our own skin type, we that have the skin of color, usually Fitzpatrick skin type 3 to 6, usually we cannot have a chemical peel done without having the skin adequately prepared. So in the case of Chukudubem, when she came in, she thought she was going to have a chemical peel on that same day. But because her skin wasn't well prepared or well primed for the procedure, so we had to also include in our routine a certain ingredient used for priming the skin for a chemical peel. So chemical peels can be classified based on the depth of penetration of the peels, and it could either be a superficial peel, a medium depth peel, or a deep peel. Just so you know, deep peels are not done on skin of color because it has so many complications for our own skin type, so we don't like to do deep peels. So for Chukudubim, like I had mentioned earlier, when she came in for the chemical peel, she wasn't well primed. So we had to give her at least 2 weeks for her skin to be well prepared, and then she would come in and have the chemical peel done, which is the new Melan peel, by the way, to address the post-inflammatory hyperpigmentation she has from the acne. I'm sure you're wondering what a chemical peel procedure looks like. In our next video, we'll be showing you how we carry out a chemical peel. Until then, do take care of yourselves. Please don't forget to like, share, and subscribe to our YouTube channel. Bye.